Hello there. Why is my cat itching? This is video 2 in a 2-video series that discusses common parasites in cats. In this video, I'm going to discuss feline scabies. Feline scabies is a highly contagious and zoonotic disease. Most clients presented scabies-infested cat to me are already infected and they are scratching themselves all over their hands, right? When presented with a cat with the scabs on the edges of the pinna, the first thing I do is wear gloves and ask my assistant to do the same. Intense pruritus is the most defeating clinical sign of feline scabies. So what causes feline scabies? Feline scabies is caused by a parasite called Notoedres cati, a microscopic parasite that closely resembles a tick and when examined through a microscope. Let's look at the life cycle of Notoedres cati or feline scabies mite. Notoedres cati life cycle occurs entirely on the cat's skin and lasts between 2 and 8 weeks. Why scabies might prefer living on the edges of the world, that is the cat's ears and face, the toes and the tail, is very difficult for me to explain. Notoedres might live on lymphatic system secretions, dead epithelial or skin cells. 3 stages of life cycle, the larvae, the nymph, and adult mites, are capable of digging burrows or caves in the stratum cornea or in the epidermal layer of the skin. That's all they do. It's from these caves that the 3 stages are able to lay eggs at the molt from one stage to another. Transmission of scabies mites. Transmission of scabies mites from cat to cat or cat to dog or rabbit or hamster or human being is by direct contact. Thousands of notoedric mites or scabies mites can live on the cat's skin and be shed on the environment. Scabies is common in outdoor cats, especially kittens. Your strictly indoor cats is unlikely to get scabies mite unless you introduce stray at the infected cat, kitten, puppy, dog, or rabbit, or hamster. Cut it out. Come on. Excuse me. Cut it out. All right? Come on this side. Go. Don't touch it. Sorry about that. My dog Chico won't allow me to do the video by barking. I hope he's going to keep quiet now. Your strictly indoor cat is unlikely to get scabies mites unless you introduce a stray at the infected cat, kitten, puppy, dog, rabbit, or hamster. Clinical signs of scabies mites. Pruritus is the most characteristic clinical sign. Pruritus from fleas and food allergy have no comparison with the pruritus with the scabies mites. No comparison. Scabies pruritus intensified by the thousands of larvae, nymph, and adult mites that are irritating the skin while digging caves inside the epidermis 24/7. Self-mutilation. The intensified pruritus will sometimes cause severe skin mutilation. Rechanification, or thickening of the skin from constant rubbing and scratching. Crusted and scabbed skin. Loss of hair or alopecia. Loss of appetite and weight. Shaggy haircut. Diagnosing Notoedres mites. A skin scraping mixed with mineral on a microscope slide and examined under the microscope, we reveal the presence of Notoedres mites. How do you control scabies mites? Since the entire life cycle of the scabies mites occur on the cat's body, treatment of the scabies is the most effective control measure. Treatment of scabies mites. My treatment plan includes 2 injections of ivermectin administered 1 week apart, and 1 injection of long-acting anti-inflammatory injected once. Your veterinarian will determine the right treatment of your cat. If the client is already infected, I normally request him or her to see his or her physician. That's the end of the video. If this video was helpful, subscribe, share it, comment, or ask a question below. I hope you have learned something about scabies mites. It's the most itchy parasite ever. And if you ever have see your cat scratching too much, has scabs on the ears, around the mouth, on the toes, around the tail, know that your cat has scabies and use gloves to handle the cat while you are taking your cat to your veterinarian. Thank you for watching. Hope to see you in the next video.